This exercise is called the median nerve floss. The median nerve is going to be a nerve that exits our neck. It travels through the muscles of the neck, down our arm, down our forearm, through our wrist, and ultimately into our hand, providing sensation to these three fingers. When the nerve gets pinched or impinged upon, you can oftentimes get symptoms of these fingers, sometimes some numbness, some weakness in that hand. Most commonly noted is the carpal tunnel syndrome, which is going to be impingement at this particular site, creating those symptoms. Unfortunately, we can have impingement elsewhere in the arm. Most commonly, as I said, we can have it in the carpal tunnel, but you can also have it in the forearm. You can have it in some of the soft tissue muscles of the neck, and then you can have it as it exits the cervical spine itself. What we want to do with this nerve flossing, like the other maneuvers, is we're going to create tension on one side of the system while creating slack, pulling that nerve, which acts as a rope, one direction. And then we're going to create tension on the other side of the system and slack and pull it the opposite direction. So this flossing is ultimately your nerve moving back and forth. It allows it to break up some of the fibrous adhesions around the nerve, and it also helps it to reduce some inflammation. So for this exercise, what you want to do is, in order to create maximal tension of the median nerve in my arm, is I'm going to depress my shoulder, so I'm going to allow my shoulder to drop down. I'm going to allow some extension through my shoulder joint, maximal extension of my elbow, maximal extension of my wrist, and maximal extension of my fingertips here. So it looks like this position. Now I'll want to create slack in the neck by leaning my head towards that side. And now we're going to oscillate to the opposite direction, which will be maximal slack of my arm here. And we're going to do that by flexing my arm forward, bending my elbow, bending my wrist, bending my fingertips, and we're going to create tension in the neck by leaning away from that affected side. And now we're going to bounce back and forth between these two maneuvers. So it'll look something like this.